too. So that's really that kind of loose association between, all right, how are lions and tigers alike? Most people say, well, they're animals, or they're carnivores, or something like that. You know, she did not. She was very focused on sort of violent associations, and really got derailed just by a pretty innocuous question. You also have a gross impairment in reality testing. So essentially you have a breakdown of distinction between the external and internal world. What's interesting in working with a support group for schizophrenics, which I do as part of my internship, there's you really see this sort of hearing an internal monologue as an external influence. So in other words, this idea of voices, hearing voices, they're basically just the internal monologue we all kind of have. You know, like, oh gosh, I didn't really do well. Well, the breakdown here is the, oh God, I didn't really do well on that exam turns into someone is telling me right now I'm a failure, you know, you're no good, you're going to be punished, and very persecutory ideas here. In fact, in general, when we talk about hallucinations and delusions, we're not talking about good experiences here. I mean, we could hallucinate puppies and rainbows and things that we all like, but generally speaking, most things that are people are hallucinating or have delusions about are very unpleasant. So we also have behavior signs, and this is where I think I found my personal biases really challenged. Actually, seeing older adults with psychosis, we all, you know, the media, and I think, you know, just driving down a freeway, see a lot of these behavior signs in people who, you know, are hospitalized or portrayed as mentally ill. So you have odd or inappropriate behavior, you know, disrobing or running around screaming. Generally, that's odd or inappropriate. Grossly disorganized, like just can't even interact with someone else because they're just so all over the place. Poor hygiene, you know, they can't really take care of themselves. Now, the next two, I'm going to sort of jump to this last point. Sometimes in older adults, they might have had, like we were saying before, this sort of kind of tendency towards something possibly psychotic. But they've been able to get by for a long time by masking this. And so what really, you know, kind of personally threw me is when you see someone who, on the surface, who looks totally normal. You don't see, you know, they're not raving about God knows what, they're not, you know, they're perfectly groomed, they smell fine, they're wearing clean clothes. These are all things that, you know, you do pay attention to when someone shows up in a psychiatric emergency, but they look fine, and it's not until you really start talking to them, and not only just talk to them, but hit on whatever they're psychotic about, that it comes out. So we'll get to that with the importance of differential diagnosis and clinical intervention. So just to sort of run through the psychotic disorders, I'm not going to define every single one of these. DSM-4, you can access it pretty much online or Wikipedia, or, you know, and it's pretty accurate. I'm going to just touch on the ones that we do see in older adults more commonly. So you have schizophrenia or schizophreniform, which is just means you haven't had schizophrenia for more than 6 months to a year. So it's sort of schizophrenia, but not for long enough yet. Schizoaffective disorder would just be you have psychotic symptoms, but you also have this sort of mood disorder that's not really specified by depression or bipolar disorder. You have brief psychotic disorder, which you don't really see in older adults. Typically, you usually see that in younger adults, and it's just, you know, something pushes them over the edge. This is, again, a colloquial way of putting it, but something pushes them over the edge, and they start having psychotic symptoms. There's a delusional disorder. So remember when we were talking about delusions versus hallucinations, this is where it's just delusions. So you just have these non-reality based ideas. And shared psychotic disorder is incredibly rare. There's some speculation that it may be more common in older adults, and what it is where you have one person with an established psychosis. It's also known as folie à deux, or say that in French. And so you have one person with this established psychotic disorder, and another person who's really enmeshed or maybe isolated with that other person takes on a psychotic disorder that is identical to that person. So it's sort of like this almost infectious psychosis in a way. But, you know, so the idea is maybe two older adults who are really isolated together, you know, maybe rural settings, or they don't have, they don't get out of the house much, they might be susceptible to that. I don't know if that's true. I haven't seen any real studies showing that. And finally, psychotic disorder, NOS, or we don't know what's going on, but this person has a psychotic disorder that is not explained by anything else, such as psychoses that are explained by a medical disorder. And this is where we really get into the bulk of older adult psychosis, late life psychosis. You see psychotic disorders, someone's coming in with an infection, or I'm lumping in their psychotic disorders associated with dementia too, which not everyone does, but again, this isn't studied a lot, so there's not a huge consensus on it, but there is, we'll get to that actually later, so I will get ahead of myself. Substance-induced psychotic disorder. Most people don't associate older adults with drug abusers, but older adults are most likely to be prescribed prescription painkillers, prescription sedatives, and other really highly addictive substances, and may you know, really have a problem with that. Again, we'll get more into this one. And mood disorder with psychotic features. Okay, so we have major depression with psychotic features and manic episode with, manic episode with psychotic features as a part of bipolar disorder. Is there a question? Sort of, I'm sure. You can stop me at any point or raise your hand or whatever. Yes?
Actually, how do you know if you have someone with a sort of psychosis versus someone with, like, say, schizotypal personality disorder?
Yeah. That is, well, actually, we're going to get to that with differential diagnosis. That's a really important question. And yeah, so there's a whole process that you kind of get into, and part of it is also knowing the diagnostic criteria, because when you have something with personality disorder, it's a little different. But we actually do. I have seen my first schizotypal personality disorder. So, okay. These numbers I'm not 100% comfortable with, because the data is all over the place, and it really hasn't been all that, there hasn't been that much agreement. But there is an idea that the prevalence of psychotic symptoms, and I really want to say symptoms, not disorders, full-on disorders, but psychotic symptoms are more common among older adults than younger adults. That is pretty much in part due to the higher prevalence of dementia, which was mentioned by Dr. Getz, how there's a higher prevalence of dementia, and along with that is going to go some higher prevalence of psychosis. In general, the general population prevalence of psychosis is about 1%. Again, this is 1 in 5 older adults who will experience psychotic symptoms. All right, so